Welcome to VetMore Podcast, where science defies boundaries and medicine evolves one species at a time. From the microscopic to the monumental, every species tells a story. Welcome to another episode of the VetMore Podcast, where we dive into the lives, passions, and inspirations behind the professionals who shape veterinary medicine, and not only. Today, we have a very, very special episode with two of my very, very favorite people. Now, Patrick Hensel, two dermatologists, renowned scientists, but also amazing personalities. Dr. Patrick Hensel is a diplomate of the European College of Veterinary Dermatology, a diplomate of American College of Veterinary Dermatology. He did his residency in veterinary dermatology at the University of Georgia, and his doctoral thesis at the University of Zurich in Switzerland. And he graduated from the University of Bern in Switzerland as well. He is a very passionate dermatologist with many publications, scientific publications, and extraordinary work. He's a veterinary dermatology consultant at the Tier Basel Münchenstein Clinic in Switzerland. He's also a consultant in multiple other clinics. He's been an instructor and a professor of dermatology at the University of Georgia. And Nao Hensel, his partner in life as well as in their practice, is also a diplomate of the European College of Veterinary Dermatology, a diplomate of American College of Veterinary Dermatology, and she is at present a consultant in veterinary dermatology at the Veterinary Medical Network in Japan and also at the TIA Dermatology Basel in Münchenstein in Switzerland, along with Patrick. Her postgraduate trainings were as well at the University of Georgia, and she graduated from the College of Veterinary Medicine and Biomedical Science at Colorado State University. They have an amazing CV, but they're also very, very exceptional, not only as a couple, but individually. I'm a huge fan of Nao. I can accept that. Sorry, Patrick, about that. And I'm very, very humbled and honored to have them in this podcast today to talk not only about dermatology, but also about their lives in a farm in Switzerland and many other subjects about their personal journey and trajectory as veterinarians in Switzerland. So please sit back and enjoy it. So Patrick, now welcome to the VetMore Podcast. I'm very, very humbled and honored to have you here. I've made all the introductions, about how wonderful you are as personalities, not only as scientists, because, I think that what makes us more extraordinary is not just our scientific part, but other aspects of our lives as well. And as vets, we are always trying to balance that out. So welcome.
Thank you.
Thank you for being here. And I'm going to start with a very, very common question. I know you've been asked probably many times. What drew you first to dermatology? I know, was it a patient? Was it a mentor? Because dermatology isn't always the first thing that vets dream of as students. You don't just see skin and say, skin is my thing, because I've made a poll to several students. So what drew you to dermatology?
I was just interested in dermatology when I was in vet school, and I just had opportunity to do some research in dermatology, and just from there I was just into it so much. Yeah. But it's interesting. I wasn't really interested in dermatology initially. I was more into, I don't know. I wasn't really interested in any specialties. When I got into vet school, I was more like, I finally got into vet school. And then I remember, I think that was orientation. During orientation, they asked, what would you like to do? What do you want to be? And then I was just thinking, I went to Colorado State University, which is famous for oncology. So I was just like, I think I'd like to be an oncologist, but I wasn't really thinking about it. And, when I was in vet school, being exposed to many specialties. And then at one point, I just became interested in dermatology.
And that you have oncology in dermatology as well. So you have,
Wow,
two in one.
Yeah, I mean, the thing is, dermatology is something you cannot get away from. You
It's
can,
the biggest organ of our body.
yeah. And then, wherever you go, whether you do any specialties or going to GP practices, how many derma cases you see. I just remember one of my classmates told me when I decided to go into dermatology, he said, I'm so glad that you are interested in somebody's doing dermatology. But even if you don't like it, you have to see it. So,
Yeah,
but yeah,
definitely.
yeah, but once I was exposed, I was just so into it.
And I suppose there are a lot of advantages, like no emergencies, life or
That's
death
what you think.
situations. That's a myth.
That's a myth. I mean, when I
Define emergency.
yeah, define emergency, right? So, okay, when I was doing the internship, I saw so many emergency cases, right? And one of the emergency cases I saw during my internship was a bulldog came in for itch. It was like at 2 o'clock in the morning. 2 o'clock in the morning. And then I could not believe. I was like, why do you come in at 2 o'clock in the morning for itch? And then that was a flea case. Anyway, so, that can be emergency for owner's perspective because they couldn't sleep. The dog scratch, 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 and then they couldn't sleep.
It's
So,
unbearable. It's
and then so,
unbearable.
that became emergency. But when I got accepted to residency, derma residency, my colleagues, who most of them went into emergency critical care, they said, "Oh, lucky you! Your life is Monday through Friday, 9 to 5, no emergencies." Then, and I was like, "Well, first of all, don't blame on me for your choice of life and my choice of life, right?"
Exactly.
But when I actually did during my residency, I actually saw real dermatological emergencies. And of course, they have to come in during the holidays. And one of them was actually, well, I had like two real emergencies during the holidays. And I had to go into the hospital during like the holidays. And both of them went into ICU. One of them was actually was
Such a
on
cutaneous syndrome.
yeah, toxic. One was toxic epidermal necrolysis, and then the other one was epidermolysis EM. Erythema multiforme. Anyways, one of them was even on a ventilator. So that can be that serious too. So a lot of people say, "Oh, dermatology, it's so easy. You just need steroids and then that's it." But it's not always like that. And then I think my colleagues actually told me, "Oh, you don't have any emergencies," but I ended up with those emergencies. I think they kind of how do you say that how do you say that? I cannot think of the word. They kind of, gave me these emergencies, I feel like. Yeah.
Human dermatologists get to be moped. They're only steroids and Botox,
Yeah, yeah.
and of course wealthy and 4 hours of work every day. This is what they say, but it's not like that actually. If you really want to
Not
do
always. Yeah.
dermatology and not beautification dermatology, it's totally different.
Yeah,
I
and
mean,
then
the
I think
science
that
behind it.
perception from non-veterinarians too, it's interesting. When they ask, I usually don't tell people what I do, but when they ask, I have to tell. And then they're like, "Oh, then do you have laser? Can you do laser on me?" That kind of stuff. It's like, dermatology is not always like that.
Definitely.
Yeah.
Patrick, how come you became a dermatologist?
Quite late in my career too. So I mean, I always wanted to be a veterinarian since like a small child. I don't know why, but we had always animals around, and I was horseback riding, so my goal was to become an equine doctor. Then I got into vet school, still want to be an equine doctor. Then I finished vet school, still want to be an equine doctor, and then I did a doctoral thesis in small animal reproduction, and then that was then the point where I kind of deviated into small animal. So I deviated to small animal, and then I became interested in internal medicine. So that was actually my goal to do an internal medicine residency. But then I got offered a dermatology residency because I did a rotation at the university in Georgia in the US, and the dermatology professor liked me, so she offered me a dermatology residency, and that's how I got really into it.
So there was no one in your environment, in your childhood environment, that was actually a vet.
No, my parents, my father's a doctor, a human doctor, and my aunt, well, that's not true. My uncle, other side, he is a veterinarian. So yeah, but that's about it. Yeah.
That was actually a medical environment around you. So you did have the
Yeah.
basis, to see how things are working in medicine. Now, were you in a
Yeah.
medical environment?
Not at
No.
all. I'm the black sheep of the family. They're quite artsy people. We have few artists in the family.
Yes, but dermatology is an art too.
If you say, I don't know. But that the only well, my dad is more in he's in mathematics, so maybe that's a little bit of part of it. But that otherwise, not really science people family wise.
And where did you grow up? Patrick, you grew up in Switzerland, correct?
Yeah. So I was born here, grew up here, different places. Yeah, and then I grew most of the time here in the Basel area where we have our clinic. But I went to vet school in Bern, I did my doctor thesis in Zurich, so in different places in Switzerland.
Okay. And then you moved to the States. And you were in the States from the beginning?
No, 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 no.
Where did you?
I was born in Japan.
That's great.
That I was actually yeah, I was actually teaching English. This is my second career. Just like one day, I just like couldn't see myself teaching English the entire life, and I just decided I was like, oh, I'm just gonna do something. I'm just gonna learn something. Well, I can do English, so why not go in somewhere and then learn something different? And then I just decided, oh, I guess I like animals. I guess I can be a vet without thinking anything, right? And then so I just decided to go to the US. But my science background wasn't there. So I went to university again, then got into
That was quite courageous. And in which town were you raised in Japan?
Nara. It's like between Kyoto and Osaka. Some people
Okay.
do know it's really famous for deer.
Hey, I love Japan and the Japanese people and the way they're structured and the way they actually achieve their goals. And you are one of these examples. So dermatology requires patience, pattern recognition, doesn't it? And a long-term relationship with a patient. So does it reflect something deeper for you, about how you approach life in general? Who wants to go first on that? Because, sometimes, haven't you thought about that? That our choices might somehow reflect, okay, maybe you became dermatologist because a residency position was offered to you, but sometimes our choices actually reflect our deeper perception about things in life, aren't they?
Yeah.
Sure. Yeah. Well, I think as a dermatologist, you really have to be a good communicator with your clients. Uh, because you have a long-term relationship with many of these patients and their owners. I think that's a really, really important part of the job of a dermatologist because you want to reach the highest possible compliance, and you can only do that if you really take the time to explain everything, to talk to these clients, to call them or email them once in a while to make sure everything's. So I feel like we do more care maybe for our patients than maybe other specialists.
From 0 to 10, the surgeons are to zero communication with the clients. I'm sorry for all the surgeons that might come in the podcast later on. And I think that the dermatologists and the behaviorists are in class 10, at the rating 10 of communication and explaining and talking.
Yeah, I don't know.
I
It's my take on that.
I think dermatology, I mean, not just dermatology, but veterinary medicine itself, I think is an interesting field because we do practice medicine. However, this is not always the medicine. Medicine is there, but it's also kind of a service business because we have to communicate with owners, and we have our patients don't tell us what they feel, what they, you know,
The neonatology.
Yeah,
Like in humans, the
exactly.
pediatricians, the neonatology, the infants, you
Yeah,
know.
exactly. And then I think when it comes to dermatology, the thing is, we cannot fix everything so quickly. It's not like a surgery. You know, you come in for surgery, do surgery, and then done. And then, what else? You know,
Instant heroes. Yes.
yeah. Like, for example, you got like your dog foreign body, and then you do the foreign body removal, and then removed it, and then recovered, and that boom. Of course, there's always complications too, but it's not like that. Dermatology is always like here. It's often dermatology is very complicated. It's not straightforward, so you have to go through step by step, and they have to come back, every time, and then we have to communicate. And the vast majority of our time is dedicated to client education. We have to educate them, otherwise they don't stick
They
with
will
us.
not have compliance
Yeah,
otherwise. So you
exactly.
deal with problems of
Exactly.
compliance if they do not understand. And if you don't regulate, I think their expectations as well, because
Yeah,
some
yeah.
people expect miracles and they don't see that they have a long path to go
Yeah.
before
Yeah.
they
So
gain a balance.
that kind of things you also have to explain, like here, we cannot just give you diagnosis just like this. We have to do the rule out or rule in, step by step. And then that means you have to stick with this, and then we cannot fix it like right away, quickly. That kind of things you kind of have to explain to the owner, especially when it comes to allergies, which is vast majority of our cases are allergy cases.
And we're going to talk
And
about
that's
that
yeah.
later on.
hmm Yeah, that's how I often feel. We just, talk, talk, talk. Vast majority of the time, we have like 1 hour appointment. And vast majority of the time, we're just talking and talking and talking, so that, they can, stick to our treatment options, and then our, suggestions and recommendations. Otherwise, we're not the one, treating, or, for example, like food allergies, we have to tell them like, you have to feed this food, and you cannot feed anything but, this food, that kind of things. If they don't understand, they don't stick to it.
I think another thing is because we spend so much time with these people or the pet owners, because like trust builds up between us and them. And so become very comfortable to talk to us. And it's almost like, sometimes we talk about private things too, not just the pet. So it becomes quite often like a close relationship with these clients, which again, I mean, because they come back over and over for the extended period of time. That's the reason why we can build that trust, and I think it's kind of nice. Also, I mean, we like to talk to these to people, and sometimes they tell us their problems at home or their own health issues. So
You're a psychologist as well.
exactly, sometimes you're like a psychologist too.
It's something, I find it a bit exhausting sometimes because even in holidays you get to have all these messages. People do not understand that you have a private life. So this is another issue that we have to set boundaries at some point. And if you see one patient once in a year, then that's fine. You don't get to have this closeness and intact relationship. But with your patients, it's totally different because, as you say, they come over and over again. So it's inevitable to create
Yeah.
this intimacy and this friendship-like environment. So from Georgia to you're going to talk to me about your life in the US. What happened? You spent over a decade teaching and practicing in the US, in the academic sector as well, not in private practice in the US, correct?
Yeah.
And then what inspired you to return back to Switzerland? And why not Japan, for example, which they're doing amazing things there?
A little bit more
Oh,
complicated.
lately, yeah. Well, I mean, originally for me, it was like more like, okay, I will go there to the US to do my residency. And then, like many residency in the past, came back to Switzerland, took a position in academia. And so we have a lot of diplomats in the universities, and they all went to the US or somewhere and came back. So that was kind of a little bit my original idea, but then my boss retired when I was done with the residency and finished it. And so I applied for the position, and because nobody else applied, nobody wants to go to Georgia. Um, So, but it was kind of nice because to see also the academic side of the profession. And I mean, I did my doctoral thesis at the University in Zurich, so I was in academia for already several years. That wasn't new to me, but it just gives you new opportunities if and again, you do the teaching with the students. So if you like to do that, then it's fun. You're like a clinician, so you have to do a little bit of research. So we did, so you have a little bit of everything. And I think
Back then, research was funded as
yeah,
well.
some obviously. Well, and then the thing is, it is basically like academia gives you an opportunity to go to like getting invited to lectures, invited to countries, to build up a reputation. And so, yeah, but like with many others, at some point you get tired of academia and the politics. It was just
What were the downsides of academia? Didn't you like the teaching part with the students and everything that you've reached a plateau? Was it the financial part there? Because you are at a plateau in the academia
Well, I mean, you
in
do
terms
the
of
career ladder, in the US, you do automatically, if you a tenure track faculty, you are first like an assistant professor, and after 4 or 5 years, if everything goes well, you can go to the next level, like associate professor. And then you can, if you continue, then you become full professor. So this is like the typical career. I liked teaching. I mean, and then we still do. I mean, that's why we like to give lectures at conferences, or we have interns. Well, sometimes.
you're wonderful speakers, both of
So,
you.
so
I
that
can say
part.
that firsthand.
But the nice thing a bit about going to conferences or like giving CEs, people who come to the conference, they want to listen and to learn. Students sometimes they didn't, so they were just sleeping. But yeah, it's okay. We did that sometimes too when I was a student. But no, why? Well, I mean, I maybe could have gone further, but I just got tired of the politics, and I think that's one reason why also people leave. For other people, the financial part in private practice, you can definitely make more money. And that's probably one big thing in the US. If the student loans you have, etc., then you need to make as much money as you can to pay off these student loans. So I guess everybody has a little bit of different reason why they leave academia or move on. But for me, it was fine. I had a good time, had a lot of opportunities. But yeah, it was a question of time when to leave. Yeah.
What was your experience now? You were taken from the US. You started from Japan, you went to the US, and then you were taken from the US, and I say you were taken
Uh,
and went to Switzerland. How was that change for you? I mean, this is a multicultural shock going around the world.
I mean, I was well when I was in Japan, I was young. I didn't feel like I was I didn't really like that cultural pressure. I didn't really like it. We have like the box. You have to stay in a box. And I really didn't like it. That was one of the reasons I left Japan. And then I was in the US, totally different environment and different culture.
There is no box there.
Yeah, everything's open and it really was good for me. But at the same time, when I was in Japan, I started appreciating Japanese culture, my origin. But that set aside, when I finished my residency, and that was back in the US, and we were already together. So the question was, what should we do? And then he was tired of academia, and we talked about opening a practice together. And then the question is where, right? Is it going to be the US? Or we looked into a little bit Canada, Vancouver, because we really liked the city. And then we also looked into Switzerland because that's where he's from. And we also looked into Japan. But Japan was, just like when we thought just a little bit about it, it's like no, 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 it's not going to work out because my license is from the US.
You have to get a recognition, a second recognition there,
No,
like
no, no, I have
like an
to do that.
equivalency,
I have to do that exam.
an
Yeah,
equivalency.
And then, so I was going, because I finished the US school, they give me the opportunity to take exam, national exam. Then, but everything is in Japanese, medical terminology in Japanese. I don't have it.
Because you were trained in the US.
And then if Patrick wants to practice in Japan, he has to take the exam in Japanese. And so they said, oh, this is not going to work out. So, that was early point. We were like, no, Japan. And then, we looked into it. And then, so Basel, this is the area where we are now. And there's no dermatologist. And then so we said, okay, this is probably a good chance, a good opportunity to move to Basel and then open a practice together. Yeah, I wasn't really thinking about US license. It's not going to work out in Switzerland. So that was, tough. But that was, kind of how we ended up in Switzerland. But I think that was really a good choice for both of us.
A very wise choice, and it's a wonderful country to live. Very, very human. I've said it in every podcast, and I know that where I'm going now, it's not going to be very much appreciated, but I think that Europe is very human-centric.
Yeah.
Compared to any other part of the world. People matter. I mean, every individual matters.
Yeah. I mean, the thing is, here, when we say we're taking a vacation, we're closing, when we take vacation, we close our practice completely, which probably is not necessarily the standard in the US,
Yes,
right?
here in Greece, when we say we take a vacation, we close the practice even one day after the vacation. So it's like...
But that people understand. They're like, oh, enjoy your vacation. So, they really respect those boundaries. I think that's
it's this work and life balance, which on the other hand, you lose some things, you gain, I think, others, and it depends on your priorities as well. And now you're living in a farm with sheep and others. I think not only sheep, correct?
Cows.
Cows. What role does the farm play in your day-to-day life? Has this lifestyle influenced your perspective on veterinary medicine, your perspective in life?
I mean, perspective for life. We are dermatologists, so we don't see farm animals as a veterinarian, but we do help farmers. When we have, like, in front of our house, there's a field and they have sheep. They move sheep, and then last year they had so many babies. And they're in a big field in spring last year. Every morning, we woke up and then grab a coffee and then get the binocular and looking for the field if there's any new babies. And then we have to get the babies. If they were born overnight, we have to take the babies inside right away so that birds are not getting injuring the babies. Not just that, but time to time we saw some dystocia, and farmers are trying to help that animals.
And they expect from you, you're veterinarians. How come, you
Well,
don't
not
know
so
how to...
much from dermatologists.
I'm a dermatologist. Okay, go explain that to a farmer. Here in Greece, they do not understand anything about, specialties or things like, hey, you're a vet. I mean, you have to come and help.
But that we do appreciate. I think after we moved here, at least I do appreciate more farmings, because we do see it. And farmers are, so like when they have dystocia and then the babies are like, born like half dead, and then we revive and then trying to get the baby back. And then when the baby came back, I was just like almost crying. It was like,
Yeah,
oh, God.
that's,
That kind of things like it happen in middle of the night, like at 2 o'clock in the
you
morning.
enjoy miracles of life.
Yeah, and that
And
kind
this is
of
where in simple things is the whole magic.
reappreciation for life.
I like the nice thing is we are like basically really in the countryside, and we just drive 12 minutes to practice. So it's everything so close, but you feel like you're like totally out in the green. I mean, it's really relaxing. So when
Yeah.
you come back from work, you can just sit in the garden. Like it's a nice view down to the valley. So yeah, feels good.
That's a quality of life. That's a quality of life. Having your practice, just nearby, and having your hiking and your other activities, in your in, integrated in your everyday life. No, not just other people, that say that I want to take an excursion to the mountains and they make it like a big fuss. You have it there all the time.
Yeah, it's quite nice. Sometimes farmers ask us to move cows. So we go to the forest in the mountains and then we walk cows.
You've
Through the
became
woods.
Heidi. Do you remember? Have you ever seen the cartoon Heidi? That was my favorite one.
It's really cool. Like what you hear is like a birds, like a chipling, and then you hear the cows' bells, like a ding, 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 and then they just walk, and then I just follow them, making sure they're not going anywhere. That kind of life I was thinking. I was like, oh, this is really great.
Isn't that a kind of meditation, guys?
It
Isn't
is.
this some
It is.
like a form of meditation? Like going to the mountains and getting all the stress out from the pressure of the work. And I think it's the best way of meditation. So I'm not going to ask now what are the more striking differences you've experienced between working in the US and working in Switzerland, because I think it's, day and night. It's white and black. It's a totally different way of approaching things.
Yeah, I think when we open our practice, we want it to be completely transparent to the client. So we did a lot in the US, we did a lot of stuff behind the doors. When we drew blood, we just took the patient into the back and then, drew blood, something like that. Just, everything. But here, we do everything in front of our clients, owners. If they want, and they can stay with us for any procedures.
Is it helpful? Now, sometimes the animal is so stressed with the presence of the owner.
No, always though. Often. So, I think, what helped, depending on the patient, but most of the owners, they stay with us during the procedures. And if they don't want to stay for the procedures, they stay until the patients are sedated. And that's, I think, also different because in the US, we usually just, when they're completely awake, we just took the patient away and then bring back the patient when they're completely awake. Whereas here, I think often owner stays until the patients are sedated. But
I don't think we have really like animals which freak out or are stressed out when the client is there. I mean, maybe we had like one or two clients we sent out of the room, but in general, it's not really a
They
problem.
don't have, because we have many clients here that are so stressed that they pass it to their animals. And when they leave the room, we can draw blood, we can do anything, everything with these patients. So it depends on the patient sometime. If
But if the
you,
client is
you
super
know,
nervous and stressed, and then the animal can feel it, I guess. And
yeah, yeah, definitely.
we
And I
sometimes
had
have
so
clients
many
which are really,
passing out
yeah. Yeah,
in the
sometimes we have,
examination.
or like, I wouldn't say annoying, but they're so stressed that sometimes it's probably better when they stay outside.
Yeah, yeah, exactly. And we had patients that were becoming not patients, owners that were becoming white,
yeah, yeah,
ready to
yeah,
to
yeah.
collapse.
It's funny. So when we have procedures like biopsies and stuff, I usually ask like, "Are you okay with seeing blood?" And then they're like, "Yes, yes, yes." And then as we are doing the procedure, I just noticed they're going like this.
Yeah, yeah. And most of them who are saying yes, yes, yes are men. I
Yeah,
don't know
yeah.
if you have noticed that, but they say yes, 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 and the woman beside them is staying like a rock, and they're ready to
Okay,
collapse.
I could sit down now.
Or I just go to the waiting room.
But it depends on the patient. I've read your recent publication with Manolis Sardomichelakis, which I loved, in VetDerm in 2024, and you explored the complex interplay of genetics, of environment, and allergens in canine atopic dermatitis. So, how has our understanding about these risk factors evolved over the years? Because now we know that allergies are multifactorial. It's not just environment, it's not just, genetics, could be many other factors as well.
Well, and we definitely don't know all of them yet. So this is like a continuous process and research. And I think there's still a lot of research needed to figure that out. I mean, it's the same like in human medicine. We basically just confirm what is seen in human dermatology or human allergy. It's basically the same. like growing up in the countryside with many animals and contact with many animals is beneficial or less likely ending up in allergies.
Being the third or fourth child of a family as well.
It sounds like it's very similar, but we have a lot of people in the field who are doing basic science and research basically about all these diseases and mechanisms of each. We don't know, we don't understand really everything yet. Probably will take a long time to do this.
Do you see more and more allergies these days? Is there a humanization of our patients as well in terms of diseases, or are we better in diagnosing a disease that was already there years ago and we just didn't know the pathogenesis of that, or we couldn't diagnose the clinical symptoms maybe? Are we going towards human medicine as well in dermatology, in terms of allergies, I mean?
Are we there already? We are there already. I mean, you have drugs which, like Apoquel, they didn't have anything equivalent in human medicine until recently, or a few years ago. So I think in some areas we are actually even advanced than in human medicine. So yeah, I don't think there's a difference. I mean, we are as specialized as like the human doctors or human specialists. Yeah, I don't know.
I think, it is complicated. Like, sure, we probably see a lot more allergies, but is that because we are better? I hope so. Is that because dogs, cats, horses, they became more family members than pets, just family pets? I remember when I was a kid, we had a dog outside. They never came inside, but nowadays people keep their dogs inside. Is that because of the lifestyle change they get more allergies? Or is that because owners notice a lot more, easier because they spend more time together? I think that's a complicated and then that's really a good question. But I think, there are, it's not just a one factor causing, the reason
Multifactorial.
for that, more increased prevalence in the allergies.
I think recognizing the diseases is probably more advanced nowadays. In the old times, I'm pretty sure we had allergy cases at that time. Just they haven't been diagnosed, recognized, and just people they want the exact same quality of medicine like in human medicine nowadays. So they want more to do more for their pets. They spend more for the medical diagnosis and treatment. So if you offer that, then obviously they go for it. Yeah.
Yeah, and I think it's interesting when we talk to human dermatologists. We were talking about when Apoquel, came, and then when they didn't have JAK inhibitor,
Okay.
they were jealous, really jealous about that.
I didn't know. This is the first time that I actually learned that we first had this tool
Yeah,
and
they didn't.
they
Of
didn't.
course, now they do. Now they do have multiple different JAK inhibitors in human medicine. And then, then we got that Cytopoint look, and they already had like monoclonal antibodies
Yeah,
in
monoclonal.
humans. And then so we were talking about like, they asked us how much Cytopoints are for pets. And then we told them, and then they were just like, so cheap. And in humans, it's so expensive. And then they were told because it costs so much for the production. And they're like, see, you can do it with this price for veterinary medicine. Why not in human medicine? It's interesting. But we
Because
are.
human industry is a total pharmaceutical industry, is totally different, level of profit and margins of profit. So you cannot touch that. But yes, you're right.
Yeah, it's
And
interesting.
what
I think,
about,
it's
sorry,
really
please.
no, but it's really we are, really close. Well, not necessarily, in every field, but we are really, compared to how many years ago, decades ago, veterinary medicine, we are not doing much of that, the same level. But I think we are really getting closer.
Yeah, at a good standard. Yes, definitely. What about food allergy or atopy? Diagnosing food allergy remains a major challenge. to all of us, I think. And based on the Food for Thought article, do you
Your
feel that we're
old article.
Yes, I came very prepared. I've read everything, but this was actually something that I'm really interested in with all these tests for food allergens that are out there. When people just GP practitioners send out for antigens and things come back, and then the patients come to the gastroenterologist and say, "Now I have this list, and I have to go with this certain type of proteins anyway." So do you feel that we're any closer to developing any reliable non-diet based diagnostic tools?
People are working on it. I mean, there's a group of people who is working on patch testing, the lymphocyte activation on lymphocyte activation testing. So there are several groups working on it, but it's far from being commercialized, or we don't know really how effective they are yet. So I think a long way to go.
Even the endoscopic test that in humans was performed, that was, not practical test at all. And how do you commercialize that? I mean, you need to help the internal medicine people to diagnose something, up front. And that wasn't.
Well, the thing is, the test may be helpful. How helpful will a test be? Because at the end, you'll still probably have to change the diet, whether you have a test result or not. I mean, we just do a elimination diet trial, and hopefully we use something the animal hasn't had before. We don't know about cross-reactivity. There's so many things we don't know yet, and that's why it's so challenging.
Yeah,
It's
I
very
mean,
difficult.
that's why after all, the elimination food trial is still the gold standard. Yeah.
Perhaps, yeah, I guess.
Yeah.
But you have clients who tell us, and they have like social media, hair test or saliva test for food allergies. Then they come with these printouts. My dog is allergic to this and this and this, although they never ate that.
That actually shows a tendency that people are interested. So if you give them the suggestions of the correct diagnostic approach, they will follow it. But, there are so many people out there that commercialize things that are not substantiated by evidence-based medicine, and they just throw away their money and they come back, with nothing. What about the skin barrier, the infection of microbiome? That's a huge, huge sector in human medicine as well. What about this? Do you foresee any personalized microbiome therapies becoming a clinical reality real soon?
It's difficult.
I'm doing fecal transplantation, to be honest, and I've seen wonderful things, especially in refractory IBD cases or in intestinal lymphangiectasia cases or bile acids diarrhea cases that were not previously diagnosed. And we have wonderful results so far.
I mean that we are it's difficult, huh? Skin barrier. There's a genetic part, and then also there's an
Immunologic.
immunologic part. It's just that it's so complicated, and then the microbiome studies in skin is also really, really a big field. But the challenging part for us is each breed has different skin, different coat. You have Chinese crescent versus Siberian Huskies, completely different. And then also, depending on the location of the skin, like armpit versus back, it's so different. So I think people are looking into it, but commercialization of like microbiome is still quite difficult, I think. And it's more.
And I couldn't perceive how you could actually give into the skin. Okay, in fecal transplantation, there's something, there's some steps to do. What do you do with the skin? How do you colonize the skin with the microbiome that you want to colonize?
I think something you can actually do is, for example, probiotic, and you get that gut microbiome, clean up. Well, not clean up, balanced. And then that actually, associated to the immune system. And then from that, connected to the skin. So in that sense, that's something you can do when it comes to skin, probiotic, looking into the gut microbiome. And then also, for that skin barrier wise, essential fatty acids supplement as a supplement. And then also the topical essential fatty acids for the moisturizer, that kind of stuff. It definitely helps for the skin barrier itself. But the problem of the supplements are they're not well regulated. So some companies or some products may claim what they have in their product, but they may not have. And then also when it comes to probiotic, there's so many different varieties, and not just, may not be regulated. I think that there is a really good study. They looked into supplements, probiotic, if they actually contains what they say. And then it was really a disaster. And then that's one thing. And then each patient is different. So one patient may respond to one product or on a probiotic, but that may not, that strain may not work for the other patient.
It's idiosyncratic, the response.
Yeah.
Definitely. This is why precision medicine is, in humans, this is what the future is. Tailor-made
Yeah.
solutions for.
But what can you do when your patient comes in as you recommend, let's say, probiotic, one product, and then they say, oh, I already tried a probiotic and they don't help. Then what do you do?
Yeah. Then it's in the study that you're saying about probiotics is out there. And many of those, not only did they not contain, but they said they contained, but they were dangerous as well for the patients.
Yeah. Like,
So this is,
probiotic has to be live too, and they're
yeah,
not.
this is
If
why.
they're dead, it's not going to work.
Yeah.
Yeah.
Yeah, exactly. And what about immunotherapy and innovation? I think that we talked about immunotherapy a bit. Do you see any of these, any other aspects in the future that might be helpful of immunotherapy?
Well, the thing is, as you mentioned before, like managing allergies is a more is case by case, very individualized treatment protocols. One dog requires more topical treatment, one more anti-inflammatory drugs, and immunotherapy is usually a big part of the management of atopic dermatitis. So we do a lot of allergy skin tests and immunotherapies patients. And, it's always so difficult to identify or define what's the success rate. We always say, okay, in 70% of cases, you can see a positive effect of it, which is probably about right. But for the individual patient, statistic doesn't really help. So I tell the client, okay, even if there's only a 50% chance in a young animal, just let's do it, because
It's a high percentage.
yeah, I mean, if it works, great. If it doesn't work, then at least we tried.
Yeah.
It doesn't hurt.
And it's the same success rates in humans as well, but yet they do it. I mean, it's out of the question.
When I explain about that allergen specific immunotherapy to clients, we usually say, that's the statistic part. The the catch is the success. The definition of success is not 100% cured. The success defined as more than 50% better. That also you have to consider that. Also, there's no test you can actually see or determine which patient respond to allergen-specific immunotherapy. In that sense, I still really, really like the therapy because that's the only therapy to work onto the pathomechanisms for the allergies. But, we talked a little bit about like a monoclonal antibodies. Those are also immunotherapy, but those are really, really helpful. Some patients get really better really quickly, but this is also just treating the tip of the iceberg. So it's always nice actually if we can, treat the pathomechanisms itself, and that monoclonal antibodies are, so for example, what we have is a site point, right? That is only targeting IL-31. So, it's very, very specific. And each pathway is so complicated. We don't know everything. There are so many factors affecting so many cytokines, so many different pathways. So
The more you read, the more you know that you know
exactly,
nothing. And that's,
exactly. So,
I'm
just
always in awe.
yeah. So, SidePoint is just targeting just one thing out of the millions of pathways. So if it works, great, but not always. So, there are probably more different monoclonal immunotherapies, coming out, but we also want in different species too, like especially like cats. We don't have it because, cats are so difficult to medicate. And, if that comes for like cats or horses, that's great. We'll see. We'll see.
Well, the thing is, there's no drug which will always work 100%. So whether if it's like any symptomatic treatment or immunotherapy, doesn't really matter. It's for all the same. Some
That's
are
true.
more effective than others, but yeah, you just have to again try it out and then you pick the one which works best for this specific patient.
What I want to go into, though, is some rapid fire questions. Okay. And it's going to be, I'm going to give you 5 questions. And it's going to be just, you're going to be quick about that. Okay. Skiing or hiking?
What kind of question is that?
You need skin to hike.
Work
No, no.
measure.
That's always a balance.
Always a balance, skiing and hiking?
Yeah, I mean that you go hiking and then you enjoy, but at the same time you miss your work too because I think I'm extremely lucky. That's how I feel. I'm extremely lucky because I love my job, and if I do it not to, yeah, sure, for work to live or live to work, right?
I was actually asking about if you like to ski more or hike more.
Oh wait, skiing or ski?
Skiing or hiking, between those two. But that was a very good answer now. And I'm going to give that because skiing,
I thought you said skin.
I thought you said skiing. Skiing.
Okay.
skiing or hiking.
Okay.
That was a good one. And I made, I make alternate the question. Yes, skiing or hiking. That was good. But no, it's skiing or hiking. Which of the two?
Hiking.
Hiking? Really?
I suck at it. I suck at
Well, she
skiing.
doesn't ski, she snowboard or did snowboarding.
Okay, snowboarding
My
as
skiing
well.
is like 25 years ago, my last skiing. I'm too old for that.
Okay, next question.
Okay, seriously.
If you could treat one dermatologic condition for the rest of your career, every day, what would it be and why? Just one.
Allergies.
Allergy?
I have the most experience in it, I think.
So difficult. I don't know. I mean,
This is why they're called rapid fire.
okay.
You're going to have to say to answer lighthearted, don't overthink about it. Don't get your Japanese mode on.
Okay, so I think allergy is a more practical answer, but I do like autoimmune disease.
Okay.
But
That's a good
it's
one.
depressive if I see autoimmune disease, also autoimmune skin diseases every day.
And I think that we talked about myths. One myth about dermatology that you'd love to debunk.
Emergency. We
Emergencies.
do have emergency.
And you are not boring.
No, what was it?
Yeah, rhetoric is supposed to be boring, no?
There's like 2000, I think there's 2019 publication or something. I think they looked into like the impression of stereotypical impression of each specialist. That do you know that paper? And
No, but I
dermatology.
can
Yeah,
I can understand it.
you should look at it. It's interesting because like a dermatology is like a boring.
Really? That was the
Nice graph with the
Yeah,
word cloud. The bigger the word, the more it fits the special.
yeah,
At the paper something.
yeah, I do.
I can send it to you.
I can send it to you. Yeah. But yeah, the myth is definitely emergencies we have. We do have emergencies, life-threatening emergencies. We also do have non-life-threatening emergencies, but we do have life-threatening emergencies.
and many people seek meaning in achievement or recognitions, and others just find it in simplicity and connection. So what gives you the deepest sense of meaning today?
Connection.
I know that you both love your work. Is it enough? And I know that we all talk about balance. Is it feasible to have this balance? And what gives you meaning?
But you have to have diversity. You shouldn't just work. You should also be able to relax and switch off when you get home, or if you take a weekend off, that you go and just switch off.
Yes,
That's
Patrick.
important. Yeah. And I
And
think,
connections, I think, friendships and
yeah,
reaching out.
you have to,
Now, what about you?
Yeah, connection. You can own, even though you love work, you cannot just work. You can't. And you need some connection, like a deeper connection of friendship, connection with the nature, connection with your family. You cannot just live it for life. I mean, for work. Yeah.
And connection with ourselves as well. Sometimes,
That's
we've
very
lost that
important.
as
Yeah.
well. Our inner
Yeah.
connection, our
I do agree.
intuition. We don't listen to our intuition sometimes. And I think that's one of the most dangerous things to do. You've helped thousands of animals and you've educated countless professionals. I still remember the positive feedback that I had from the Congress, from the Middle East and Africa Veterinary Congress. Everyone was talking about the dermatology sessions, especially in this world of no. What are you most proud of? This is what I wanted to ask you. What do you still hope to accomplish? And then I will ask you the other thing that I had.
You mean like in life or in dermatology
In
wise?
general.
In
In
general.
general.
In general, finding happiness.
Yeah.
you're not?
No, but happiness is not the plateau. It's not. And then life is always, there's always ups and downs. And then finding happiness when you're down, that's the most difficult part. But you still have to look for happiness. I
You
think,
said something that's very important. Happiness is not a plateau. It's just moments,
yeah,
that you look back.
yeah. And
You,
then the
Patrick?
happiness, sorry, one more thing.
No,
Happiness.
please.
I mean, the happiness, it's difficult to define, right? But happiness is what you decide. That's not something somebody's not going to give you happiness. You have to find the happiness. You decide if you're happy or not because you have to find the happiness. Yeah.
Well, for me, like on a professional side, I think for me or for us, I guess, is if you can, the young veterinarians, if you can make someone really interested in dermatology, whether if it's a conference lecturing or you have an intern and they say, yes, this is great, I want to pursue that route. That's kind of nice to see then, the new generation of to help to develop a new generation of dermatologists.
Yeah, I think it's important when we go conferences. I try to connect with the audience. And what I want to show is, like that the stereotypical dermatology is boring, right? So, but it's not boring, it's fun. I want to also share my passion for dermatology and I want them to find some fun in dermatology. And every time I give lectures, I always try to connect with the audience and then try to share that part.
Yeah.
And
And you do.
if
Both of you are.
they
You're
find
very
it,
connecting with the audience and people, you give tips that they can take into their real clinical practice and just apply them the very next day. Because the more perplexed you give the audience, the tools, the more they will not do it eventually. And it's not to anyone's benefit if people do not practice good medicine because they will not know when to refer to you as well. If the vets are not educated, they will never know which is the point that now I have to refer my case
yeah,
as well.
that's
Did you
important.
have any problem with the referrals?
Sometimes we do. We do because going back to the stereotypical dermatology, it's easy, right? It's easy. You just give steroid, and then now we have different tools. Like when it comes to allergy, if they're itchy, then give Apoquel, give steroids, or give side point injection. But it's like just treating the symptoms, right? So they come back, but they're like, okay, it's so easy. Just give medications and then just go through that part. Don't not all the veterinarians are like that, but some of them are like that. Some people straightforward said dermatology is easy, we don't need a dermatologist. Yeah, some people do say that.
Well, I think, yeah, because, sure, if you have like a surgery issue or a case that and you cannot do yourself, you send it. Skin is, yeah, in that regard, something which many practitioners try to handle themselves, and many can do a pretty good job, I think. Certain things are complex, which it would make sense to have a dermatologist involved. I mean, if I have some specific problem, then I want to see a specialist. I don't, because they can handle that the best. And over time, sure, it was at the beginning a little bit difficult because in our area here in Basel, we didn't have any specialists. We were basically the first ones in the area, and so many practitioners.
Vets are trained more to refer as well.
The younger ones are aware they're specialists, and yeah, compared to the older veterinarians who are retiring soon, definitely there's a huge difference. And we definitely do see more and more referrals, but we still, we do take cases in when a client calls and says they want to come to us. They don't have to be referred. They can just straight make a direct appointment with us.
And the key is to refer it to you before giving steroids, because this is what they do in our case as well. They always have tried everything, giving steroids, and then we cannot take biopsies, we cannot do anything unless we wean off our patients, and that's a huge difficulty.
Yeah, but that I think, when they have come in for, the steroid on board, and then we try to wean off and then use different medications to a point of, we can do a little bit more diagnostic and stuff. And then that's, I think, it's part of our job. Then one of the reasons some GPs didn't refer cases, especially when we first opened, was because they thought we were taking their patients. And they thought
They will lose a client. Yes,
they
the patient.
also thought we will do general medicine too, which we don't. We don't give vaccines. We don't do anything but dermatology. We only do dermatology.
And that builds trust now.
Yeah.
If you don't do general dermatology, because GPs, have to practice somehow what they know. And
Yeah.
if you're just taking a piece of the pie that belongs to them, why should they ever refer? Yeah,
Yeah.
definitely. Definitely. Is there a personal philosophy, quote, or a belief that you return during times of doubt or during times of transition? Is there a motto of life?
Motto of life. Find happiness.
Yeah, no,
I mean that.
it
I
doesn't
think that
necessarily have to be from a book, or something.
Well, I'm sorry.
Well, think positive. Yeah.
Think positive and move on. I mean, some there will be always times where something sucks and doesn't go as you want, and then you're like, okay, learn lesson. I learned something. I screwed up or whatever. Try to make it better next time.
Yeah.
I mean,
Failure is a part of learning process, isn't
yeah,
it?
life is learning, and I think that's part of life. Just learning every day. But when I come to the point, like, I have to choose between this and this, then just try to choose the one make you happy, that kind of good for you, makes you step up, something like.
If I, striped you away of any title, of any achievement, of any degrees, okay, who is Patrick and Nao in the core, in its core? Who are you? If you weren't, how do you identify? If you weren't a dermatologist, if you weren't, all the achievements that you have, publications, residencies, diplomates, and everything, diplomas, who are you in the core? That's a very difficult question. How did I write the questions?
I think what I always say is I really don't care about titles, to be honest with you, because the title doesn't define me, who I am. And so that's one of the things, like German speaking countries, they are, not so much nowadays, especially in Switzerland, but people stick to the idea of doctor, doctor. But, I don't have to be called a doctor all the time. Doctor is my job, but it doesn't define who I am. I just want to be
Authentic.
I am who I am.
Yeah, I mean, I cannot, I think the way how people react when they interact with us, that's basically, I think tells me that we are approachable, we are funny, and
Very warm and very kind. I can say that firsthand.
I
Very.
mean,
well, yeah.
it's difficult to define like in one word who I am, but what I want to be is I want to be well, at least, I hope people think I'm approachable and kind, considerate, that kind of, easy to connect.
That's a great asset. That's a great asset. Kindness, I think, is undervalued in our era. And I think that it's one of the biggest assets, not only for a doctor, but I cannot imagine being either a human doctor or a veterinarian that is deprived. You can be the best technical, you can have the best technical achievements in endoscopy, in surgery, in everything you do, and have the best technical skills. Yet it's not enough. It's not enough. It's never enough. You have to have other aspects, within you developed.
Yeah.
One of my favorite, and just to wrap it up, one of my favorite writers is a Japanese writer, and I do read a lot of Japanese literature. I have practically my library is full of Japanese writers. Kawabata, Murakami, of course. He's my favorite one.
Yeah.
He used to say that I just let myself get carrying along the current. That's what I did. And I let myself float. I imagine that's how I chose my profession. When they asked him, how did you become a writer? And it just happened, So looking back at your path from your early years in Zurich and you in Japan, and now to your life, okay, on the farm and the private dermatology practice in Switzerland, do you feel like you chose dermatology or that it somehow chose you along the way? Was it like a deliberate passion, or was it like more what Murakami describes as being carried away and later realizing that it felt right?
I think that it isn't, I cannot, it's just me, but I cannot say, one way or the other. Wanted to, so if I look back, my life, back in Japan, even from the high school period, going to college and, blah, blah. And then it decided to go to the US. And then I went to the university again, went to Colorado State University, internship, residency. Is it something I really wanted to do? Yes, but at the same time, opportunity also came too. So it's also that opportunity, just I don't call it flow itself, but it's also a luck, right? You have to have like a genius. I think that was like, who was it? The crazy guy. Einstein. I think Einstein. Was it Einstein? I think that was he's saying genius is 99 what you have, you're born with, or something, and then 1%. No, or the other way around. You need both of them
You need both
order
to get forward.
reach to that point. And then I think that when I actually look back, I had opportunity to, yes, I wanted to go to the US and study veterinary medicine, but I was lucky that my parents let me go. And then my parents were super supportive. And when I went to the US, I finished my undergraduate again, and that I got accepted to Colorado State University. I studied, yes, so I put a lot of effort, but also there was luck that, I got into it. Internship too, and then residency too. And then now here we are. That was a great timing because there was no dermatologist in Basel. Timing was perfect. That was
It's like everything is aligned, huh?
yeah.
Everything.
I wouldn't say everything was a flow. We also put effort too. I also put effort. So I think it was a both way.
It's kind of destiny, you go along and then there's some opportunity opens up which you didn't expect, and you think like, that sounds like the right way to go, and then you deviate from your original plan, and so you go with, so to say, with the flow. So I mean, in kind of yes, I would say, and I definitely don't regret the path we took and where we are.
I don't know if we have luck or if we make luck, if we, with our choices, actually make options that lead us to opportunities, and then you just open up the right doors. But as Nao said, there's a lot of work. It's not effortless. There's a lot of work behind that in order to get, to where you are and to open the correct doors to lead you somewhere. Thank you so much, both of you. Thank you so much. Thank you, both of you, for being here
It was
and for
fun.
being so true and honest and kind